So what inspired you to do anesthesia?
Well, anesthesia wasn't my first choice. I have always wanted to be a family physician, having my own practice in the heartlands. Thanks to my persistent mentor, Dr. Siva, who enrolled me in an anesthesia course, gave me a training scholarship, a fellowship to do the exams, and thereafter, I think that was history.
Well, I'm glad you did anesthesia. I don't know whether you remember, but you were the one who waved the cardiac fellowship in my face as well. Exactly what I wanted to do.
Right.
So what does mentorship mean to you?
Becoming head of the department at 37 years old taught me the importance of mentorship. Building a cohesive team and nurturing future leaders became my priority. I had staff that were my seniors, as well as my peers and nurses and doctors. So my way of driving the department forward was to make sure that the team spirit has to be very strong.
Weng, I think you really have pushed anesthesia into new boundaries, and we're very proud of you being the first anaesthetist to be accorded the Emeritus Consultant.
Hello, Dr. Kwa. I think one of the first things that we would all like to know is that what inspired you to choose the field of oral pathology?
In the 1980s, when I started thinking about specialty training, there was only one practicing oral pathologist in Singapore, and he was getting on in age as well. So I thought that this was a particular hole in the development of dentistry, which I could possibly fill, and decided that I would train.
In our field in healthcare, how do you see mentorship as a very important aspect?
To me, mentorship was being able to meet with young people and helping them to come to some sort of self-realization about what precisely drives them to do what they do. Doctors want to be good at what they do, but that is not enough. They need to be able to do good as well, giving back to the healthcare community or the community in general.
How do you feel being accorded this title of Emeritus Consultant?
To be honest, I haven't thought about it all that much. What I did want for myself was to be able to continue to interact with the young doctors simply because they keep me interested.
So Prof, we know you have mentored many in the field. How has mentoring others shaped your own professional journey?
As doctors, I think it is just in our DNA to treat patients, but also to teach, to impart whatever knowledge that we have to our junior colleagues. To be a mentor and to be able to teach, you need to be good yourself. And also it helps you to reinforce your knowledge and hone your skill and to improve your skills. Although I teach, I also learn a lot from my junior colleagues, in which I'm very grateful for.
How does it feel to be accorded the Emeritus Consultant title?
This is really a great honor, and I'd like to thank National Heart Centre for this privilege to be an Emeritus Consultant. But work-wise, nothing has changed. We carry on to what we've always been doing and do the best for our patients.
Thank you so much, Prof. Nobody else I know deserves this more than you. You have impacted so many of us, and I'm so lucky to have the privilege today to tell you personally, for me, what you mean to my career and what you mean as a person.